With COVID cases surging over the past few weeks here in Western New York, hospitals are again bearing the brunt of the ongoing toll of the pandemic. Channel 2's Ron Plants has more on what our medical institutions are dealing with as they try to meet the demand from patients.
While a lot of people have been worried about the latest COVID crunch and the increasing caseload for our area hospitals, it turns out that they've been in a case of institutional critical condition for some time, especially when it comes to staffing and other elements. Erie County reports COVID hospitalizations now over 200 for local hospitals, which collectively said during a county briefing earlier this week that they're simply running out of room to put everyone who needs treatment. Dr. Sam Cloud, ECMC's Associate Medical Director, points to staffing nationwide for one point.
There are some indications that nationally up to 20% of the healthcare workforce has left healthcare currently. And so there's a big crunch.
And as for why, they're currently seeing a multitude of patients, a multitude of factors.
The reason it's been that high is partially because of COVID. We have 30 patients in the hospital today, and that's quite a big number. You know, we don't have 30 of really any other type of patient in the hospital. So the COVID numbers are rising. But in addition to that, patients are sicker than they were before the pandemic. And that's probably a combination of them, delaying some health care during the pandemic. There's been more alcoholism and substance abuse since the pandemic started, more depression.
Dr. Cloud is of the opinion it may get worse before it gets better for hospitals, especially with more people inside for the winter months, with a very infectious Delta variant running rampant through those who are younger and unvaccinated. So the emphasis again on vaccination and now boosters to put out the wildfire of COVID. Ron Plants, Channel 2 News.